Hello everyone. Today, we will address a subject that can be very uncomfortable and unpleasant for many people, oral herpes. I know it can be uncomfortable to talk about, but it's important that we be aware of the causes, symptoms, and treatments for this type of condition. Oral herpes is a viral infection that affects a large portion of the population. This infection is highly contagious and can be transmitted through direct contact with active ulcerative sores. Despite its commonality, it is often misdiagnosed as other issues. But don't worry. Here, I will explain everything you need to know about oral herpes. If detected early, its symptoms can be treated with antiviral medications, protective gels, and anesthetics. Additionally, there are simple measures that can be taken to prevent its transmission and recurrence. I am Dr. Giuseppe, and I am eager to share more valuable information with you. Let's get started. Before we begin, don't miss the opportunity to always stay updated with reliable health information. Subscribe to our channel, like this video, and share your suggestions in the comments. What topic would you like to see covered here? Oral herpes, also known as oral or intraoral herpes, is usually caused by the herpes simplex virus type 1, HSV1. In some cases, it can be caused by HSV2, which is more commonly associated with genital lesions. It is important to remember that HSV is highly contagious and can be transmitted through direct contact with active ulcerative lesions, such as saliva, kissing, sharing household items, and clothing with an infected person. The average incubation period is about 7 days. After initial exposure, the virus moves through the skin and mucosal nerve endings to reach the trigeminal nerve ganglion, where it becomes established. From there, it can be reactivated by various factors, such as fever, low immune defenses, infections, hormonal changes, stress, among others, leading to local recurrent infections. There are different types of simple oral herpes, including primary herpetic gingivostomatitis, which occurs during the first encounter with the virus, and recurrent sores, which occur in patients who have already had a herpes infection. Approximately 60% of adults experience an outbreak of herpes in their lifetime. The symptoms of herpes infection begin with burning, itching, and tingling around the edge of the lips, followed by small yellowish blisters that appear on the lips or nearby areas, such as cheeks and nose. In some cases, there may be painful ulcers in the mouth, such as on the palate or gums, which usually heal in 8 to 10 days. The blisters dry and break open, forming wounds that form a crust, which disappears in 8 to 15 days. In more severe cases, there may be blister-like sores, primarily located on the palate and gums. These blisters ulcerate quickly, causing inflammation and pain. They typically heal without scarring in 8 to 10 days. In addition to the previously mentioned symptoms, a first infection with HSV, one can also cause fever, gum pain, sore throat, headache, muscle pain, or swelling of the lymph nodes. In children, the first encounter and infection with the herpes virus is usually asymptomatic, although it can also cause herpetic gingivostomatitis, which is the main cause of stomatitis in children aged 1 to 3 years old. This condition often causes high fever, malaise, headache, decreased appetite, and sore throat, so it can be mistaken for pharyngitis. A few days later, the gums become swollen and inflamed, causing significant pain when swallowing. A few days later, several blisters appear anywhere in the mouth. The oral herpes virus is highly contagious and can be transmitted through direct contact with active ulcerative lesions, such as saliva. Thus, it is important to take preventive measures to avoid transmission, such as avoiding direct contact with infected individuals, not sharing utensils or towels, and frequently washing your hands. If you have already been unfortunate enough to be infected with the herpes virus, then you know that outbreaks can be a constant concern. But don't worry, there are simple measures you can take to help prevent its reactivation. It's important to lead a healthy lifestyle, including reducing stress, maintaining a balanced diet, getting enough sleep, applying sunblock on your lips, and using a moisturizing balm to help protect your skin. If oral herpes symptoms arise, it is important to act quickly to prevent the spread of the virus. It's important not to touch the lesions to avoid infection and aid the healing process. If you act early, oral herpes can be treated with antiviral medications. However, if the virus has already manifested, treatment is usually symptomatic, including the use of protective gels, anesthetics, or local cold applications. Take steps to prevent its reactivation and protect yourself from infection. If you have any questions or need treatment, don't hesitate to seek medical help. It is especially important to do so if you experience frequent outbreaks of the virus. To conclude, I would like to emphasize the significance of health in our lives and inspire the adoption of healthy habits for overall well-being. Don't miss out on staying informed with the latest and trustworthy health information. Subscribe to our channel and give this video a like. Together, let's prioritize our health and maintain balance between our body and mind. Thank you for watching, and until next time.